Hello there, Dr. Mashhood again with a video on COVID-19. The topic we're going to discuss today is when to end your self-isolation or home isolation and when you can be safely discharged from the hospital. Now the point to remember is different parts of the world have their own guidance based on their population subset, their resources and their economic welfare. But the guidance which is normally followed all around the world is the guidance which is published by WHO or the World Health Organization. The WHO has published two guidances in regards to when patients should end their home isolation or when they could be discharged. The first guidance was published on the 12th of January 2020, and what it essentially involved was it mentioned that patients can end their self-isolation or they could be discharged from the hospital if they have two negative RT-PCR tests 24 hours apart. That means you need to have two negative PCR tests to be discharged home or for you to end self-isolation. Now the problem with this guidance was it was putting a lot of pressure on countries because initially they did not have the resources to do the PCR test. Hence, WHO revised the guidance and published another up-to-date guidance on the 27th of May 2020. What this guidance tells us now is for patients who have symptoms and are COVID positive, from the day of their symptoms started to up to 10 days, they should be in home isolation or in the hospital, depending on the local arrangements. And after 10 days, if they are 3 days symptom-free after the 10 days, they can end their self-isolation or could be discharged. I'm going to repeat again. From the time of onset of the symptoms, if a patient is COVID positive, up to 10 days they should be isolated. And after 10 days, for the next 3 days, if they're symptom-free, they can end their isolation or could be discharged without any further test, without any PCR test. Similarly, the second part of this guidance is for asymptomatic patients, they should be isolated only for 10 days. And after 10 days, if they still have no symptoms, they could be discharged or they could be, they should end their self-isolation. And we see a lot of patients, a lot of healthy patients who have been diagnosed with COVID-19 but they have no symptoms. For them, they only have to isolate for 10 days and after that, they could be discharged or they could end their isolation. This is what WHO recommends. However, WHO has taken into consideration that in spite of these guidances, there is still a very, very low risk of transmission, especially in vulnerable or elderly patients or immunocompromised patients such as renal patients. So these patients need to be taken into consideration upon ending your self-isolation. If you have any questions in regards to ending home isolation or ending self-isolation, please mention in the comments below or contact us through WhatsApp. If you like this video, please subscribe to this channel and share this video.